Jenna Webb. I work with SHA Communications and I'll be moderating the event this afternoon. In the room with me in Regina is our CEO Scott Livingston, and he's also joined by several folks on the phone. So to do introductions and kick us off, I'll turn it over to Scott.
Thanks, Jenna. So good afternoon, everyone. Today I am joined by a number of SHA staff. Today I'm joined with Dr. Susan Shaw, our Chief Medical Officer, Dr. Julie Krzyzanowski, our Senior Medical Health Officer, Mr. Derek Miller, the Commander of our Emergency Operations Center, Dr. Jenny Bazaran, our Senior Medical Information Officer, and our Chief Medical Health Officer from the province, Dr. Saqib Shahab, is also with us to answer questions today. I'd like to start by acknowledging that today is International Nurses Day, and it's also National Nursing Week here in Canada. And on behalf of the Saskatchewan Health Authority, I'd like to send up my sincere appreciation to nurses across the province. Their leadership across our response to the COVID pandemic has made significant differences in the lives of many patients across this province, and nurses are leading the way in contact tracing, swabbing, assessing COVID-positive patients, at the same time caring and supporting our clients, residents, and patients across this province that are both COVID and non-COVID during these exceptionally difficult times. Your leadership and dedication and compassion in helping our province answer the call for care and support is recognized. Despite the risks to many of you, you have stepped up when we've called out for resources, particularly to northern Saskatchewan, and we continue to ask you to do that, and you continue to respond to our calls. So again, thank you very much for doing what you do each and every day. Today we are beginning a harm reduction strategy in the Loche. It's called a managed alcohol program, which will support minimizing the risk of transmission in that community and around that community. Community leaders as well as healthcare teams across the Loche have recognized the additional stress that public health measures can bring to vulnerable members of a community living in such a geographically isolated area. Managed alcohol provides regulated doses of alcohol to program participants as a way to address problems associated with severe alcohol dependencies. It's a program that the SHA has seen success in with partners in Saskatoon. It's needed to support as we continue to work together to manage the outbreak in the far northwest. Our outbreak management also continues in Lloydminster and Meadow Lake hospitals, where we're making progress. In the Lloydminster Hospital, mass testing of hospital workers is nearing completion, and we've had no new cases over the last 5 days. Although we continue to be vigilant, we see this as a sign of progress. For Meadow Lake Hospital, we still only have one positive case associated with that outbreak, and while we are being cautious, early signs are that quick action by local staff and physicians help mitigate further spread. Finally, as you know, last Friday, the outbreak at PA Vic Hospital was declared over. Again, strong PPE practices at the Victoria Hospital, along with quick action of our MHO and staff locally, once the case was discovered, helped mitigate the spread and protect our patients and healthcare workers. Although we're proud of the actions taken by all healthcare workers throughout the outbreaks in the province, as a matter of standard practice, reviews will be conducted on all of the SHA facilities where an outbreak has occurred to identify any improvements that can be made, and this will be a standard practice throughout our COVID response. These reviews are critical in supporting us to be vigilant and minimize the risk of exposure to both our staff, physicians, and patients. It's also important that we all continue to follow and respect self-isolation measures surrounding positive cases. As we learn from these situations, we do need to keep in mind the public health definition of outbreak does vary by setting. The declaration of a COVID-19 outbreak is used by public health to mobilize and coordinate a response to the infection, and it's not necessarily an indicator of risk to the public. While an outbreak is declared when one person or a single resident or health worker test positive for COVID-19 in long-term care or personal care homes, the posting of outbreaks in workplaces, industrial or commercial spaces will be done on a case-by-case basis when deemed appropriate and necessary by the medical health officer. Public advisories will always be issued when there's a risk to the public. Yesterday, you heard Dr. Shahab refer to this, but as a result of recent improvements, the outbreaks in the province of Saskatchewan are now posted to the COVID-19 website to ensure transparency and clarity. Whether you're in an area where there is an outbreak or not, we need to ensure that we're keeping our physical distance from others whenever possible. We need to ensure that we are protecting our vulnerable populations, minimizing essential travel, and practicing proper hand hygiene. While we each do this, our focus as a health system remains on contact tracing and testing. These two components are critical if we are to continue to stay on top of the virus across communities in this province as we find a new normal. Beyond what we're doing clinically, we know that we also need to work to support each other through what can be a challenging and lonely time. That's why we continue to strengthen our virtual visitation strategy, particularly for long-term care residents. The strategy took a huge leap forward late last week with a significant donation of iPads from West Cap Management Limited in Saskatoon. These types of donations are helping us keep families connected virtually. We will continue to build on this strategy to create safe connections for our residents in long-term care and to help battle the scourge of loneliness. In a similar vein, we are also working to strengthen our supports for healthcare workers. As part of our COVID-19 response, we have launched a healthcare worker mental health support line. This support line will complement the mental health supports that we already have in place for employees and physicians across the organization, but the new system will ensure seamless access for physicians and staff so they can get support quickly and easily. In general, we need to reduce the fear and stigma associated with COVID-19 and stick together. We know that the outbreaks are not just something that happens to others, but something that can happen anywhere in the province. Even jurisdictions like South Korea and Singapore that have been heralded for their quick and strong responses to COVID have seen recent flare-ups in recent weeks. Even as we open up our economy and the healthcare system, we have to manage these challenges as they arise. Even as we stand apart, we need to continue to stick together to fight COVID-19. And on that point, I'd like to turn it over to our Senior Medical Health Officer, Dr. Julie Krzyzanowski, for a few comments before we take questions. Julie?
Thank you, and good afternoon. Saskatchewan is a cooperative province that often focuses on the common good, and unlike other parts of the world, we do have plenty of space to physically distance. Both reasons are at the heart of why COVID-19 has not yet overwhelmed our health system. That's why we need the people of Saskatchewan to continue taking COVID-19 seriously and to keep doing what you're doing, physically distancing, washing your hands, and following public health orders to keep yourself and others safe. It is natural to be concerned and sometimes even fearful about COVID-19, but in some cases, people are fearful of admitting symptoms and getting tested, and I am very concerned about that. I have seen some people being stigmatized during this pandemic, those who are sick with respiratory illness, emergency or healthcare professionals, and other essential workers, people from northern communities, and Indigenous people. Stigma against those people who have COVID-19 or who are living and working in communities with COVID-19 outbreaks is preventing some of us from seeking testing. Some, especially those who are part of small communities, fear being identified as having symptoms. But when we self-isolate and seek out testing when we have symptoms, even if mild, or have been in close contact with others who have symptoms, we are contributing to the health of the whole population, and we're challenging fears and stigmas at the same time. Northern Saskatchewan and some Indigenous communities have been hit extremely hard by COVID-19 in the past few weeks, just as the southern parts of our province were hit harder earlier this spring. The fact is, this virus is extremely contagious. Anyone could get it, young and old alike. We should be celebrating those who are heading into the testing centers. They are doing their part. Please don't stigmatize them. It might be other people today, but it could be any of us tomorrow. Our healthcare professionals are putting themselves at risk every day, coming to work to serve their community. They are taking every precaution to ensure that the virus doesn't come home with them, so please don't be afraid of those you know who work in hospitals when you see them out in public or when you go to seek care. Stigma divides. It turns us against each other. But pandemics are an opportunity to remind us of how connected we are. Compassion, care, unity, and resilience makes everyone safer and stronger. Stay positive, stay informed, call out rumors. If you have symptoms or think you've been exposed to COVID-19, call a health professional or Healthline 811. We are all in this together.
Thank you, Dr. Krzyzanowski. We'll move to the question and answer period. There are no reporters with me in the room, so we'll go to the phone lines.
We have Phil Tank with the Star Phoenix.
Yes, I'd like to ask Ms. Krzyzanowski for her to elaborate a bit on what she's seeing in terms of stigma. And maybe is this connected to, I saw a Facebook post that they're starting door-to-door mobile testing in the Loche, I believe, today. Is there a connection there between the stigma and trying to avoid someone going into a testing center or something like that?
So what we've seen in the province over the past number of weeks is a decrease in testing numbers, and we're working hard to understand why that is the case. Part of it is a good news story in that we also believe that those decreased testing numbers reflect decreased levels of respiratory virus that are circulating, and that reflects the effectiveness of the public health measures that are in place. They're working. But at the same time, we also know that there may be barriers to testing, and we're working to understand and resolve those. And one of those barriers is stigma. People, especially in small communities where confidentiality is a concern, have reported that they do not want to be tested if they can be identified as having COVID-19. In addition, we know that stigma is not something that affects just individuals, but whole communities as well. So this is all part of what we need to be looking at and proactively addressing and getting the message out that testing is important, not just for individuals, but it does help us understand how the virus is being transmitted in our communities. And that's really important to be understanding the effectiveness of our public health interventions as well. So the message today is to get tested if you have symptoms, no matter how mild. And we use testing and active case finding strategies, including door-to-door testing, as part of our outbreak control measures. So not necessarily related, but an important message to get out.
Is there a follow-up?
Yes, I'm looking at the update today, and on the first page it says there will be a variation in how the resumption of services happens in different areas of the province. Can I get more specific information on what that means exactly?
Sure, I'll start, and then Derek or Susan could kick in. But because we know that we are going to have to be managing outbreaks throughout the upcoming months and years, potentially with a vaccine on the horizon, as we manage outbreaks and we see potentially outbreaks affect services in areas of the province, like it did in PA, where we had to isolate a number of employees and or Lloyd, we would want to have the ability to either scale back services where those communities were being impacted by outbreaks. So in that way, although we're planning the restart of programming across the province, there may be differences based on what's going on in the local communities next week or a month from now or 2 months from now. Derek, did you have anything you wanted to add?
No, I don't have anything beyond what you said, Scott. Thank you.
Next question, please.
We have Alicia Bridges with CBC.
Hi, thank you. The Premier said last week that testing has ramped up in the north where it's needed, but not so much in the south because there are fewer cases. And because things have changed since the initial goal of 1,500 tests daily was announced. But can you please explain in more detail why, as we reopen, you will not be doing more proactive testing in regions where there are fewer cases? Would that not help identify outbreaks earlier, identify cases where people are asymptomatic?
So I think Dr. Krzyzanowski already touched on that in her response to Phil, but Julie, did you have anything you wanted to add to the response for Alicia's question?
Yeah. So with respect to a strategy for testing in the province, our priority is on persons who have symptoms of COVID-19. And again, even persons who identify as having very mild symptoms are recommended to have testing. In addition to that, though, looking at other testing strategies to help us manage and control outbreaks and to help us monitor for evidence of community transmission. So that may include testing of asymptomatic persons, especially in high-risk populations and higher risk settings, including in, for example, long-term care facilities or personal care homes. So all of those are part of what a provincial testing strategy does include. And we will continue to monitor and evaluate and adjust as we need to do so in response to what we're seeing in Saskatchewan, but also as we learn more about the COVID-19 virus and how it transmits in the population.
Is there a follow-up?
Yes, thank you. Can you please provide as many details as possible about the alcohol management program in Loche? What is its status, how will it work, and why?
So I'll start because I would say, although the program's in its infancy from a starting point, what's been going on in Loche over the last week, as you know, not only were we going home to home, as Philip brought up today around testing, but we've been doing that with our local MHO and teams to do assessments for harm reduction, as well as what the isolation parameters are for those families. Are they able to self-isolate, and can we help them and support them by providing other alternatives? So that through that work, as well as work with the community and local leaders across the Northwest, and the decision that was made to close the local liquor stores, a response for managed alcohol was required quickly. This is a program that does exist in the province. We have experience in this space with partner in Saskatoon. So the managed alcohol program, as I had mentioned, is a program that literally supports those folks that are having chronic dependencies, and the program's in place to help support them through this change where they don't have ready access, but the outcomes of going into withdrawal can be much more severe than managing them with the alcohol program, including counseling. Now, the program has just started. They've done some identification of individuals across the community, looking at what resources are going to be required, as well as have some expertise from some physicians that actually already work up the north with managed alcohol, and they have liaised with the team in Saskatoon, both our primary healthcare team as well as our EOC, where we do have some experience in this space. The details of exactly who's in it, how long they're going to be in it, and how we're going to do it have not all completely been worked out, but Derek probably has a more up-to-date response with respect to the managed alcohol program in the Loche than I do. So Derek?
Yeah, so what I can say, just in follow-up to your response, Scott, the team locally, consisting of our clinical leaders and working with other partners in the community, as well as the RCMP, they have put together an approach to be reaching out to local individuals that are identified either through the emergency department or through other means as they start rolling out this program. So that has started over the last day or so, and will certainly be an important part of ensuring that we minimize potential harm related to alcohol. Again, this was ramped up very quickly in response to the changing situation on the ground there.
And if you'd like some more information, Alicia, regarding the program, feel free to reach out to our media relations team, and we can have a specific program-specific individual follow-up with you on your questions. Can we go to the next question on the line, please?
We have Lisa Schick with CJME.
Hi, I'm just wondering if you guys are hearing much from people who are waiting for surgeries and procedures. Is the SHA getting a lot of pressure from people who are kind of sitting at home waiting for those things to happen?
I'll turn the question over to Susan Shaw in a second, but I'm not hearing it at where I am in my chair, and people aren't bringing that to me. But I can tell you what we are seeing, and we have brought this up before, Lisa, is we're seeing more people coming back to our hospitals, particularly our larger facilities, and we're seeing people with chronic diseases, those conditions that are often well treated and controlled in the community, but we're starting to see some of those folks with what's called ambulatory care sensitive conditions like COPD, chronic obstructive pulmonary disease, high blood pressure, diabetes, and heart disease coming into the facilities and requiring admission. And that's a good signal for us that it's time to restart everyday healthcare services, because we need to be properly caring for these patients out of facilities so that we can help support the restart of other services when we require inpatient beds. And Susan, I'm not sure if you have anything to add. I know you've talked to some surgeons
Yeah, we know that we have many patients across the province who have have had their care delayed or deferred due to the necessary response to be prepared for COVID. We also know that these are patients that are waiting and are curious about when their care is going to be resumed. It's important that this be done based on patient need and patient indication. So it's very difficult to plan a restart based on a surgical procedure or a specific type of operation. It's more important, I think, to focus on how a patient's doing, what's their level of individual urgency, and that's a decision best made between the patient, their family, and the surgeon or the other physician who's involved in their care. When I talk to the surgeons about what they're seeing in their private offices or in the clinics that are run through the SHA, they are getting questions, but there does not seem to be a groundswell of patients who are seeking a lot of information at this time. I think the public has been very understanding and willing to wait to an extent. I certainly don't want to make it sound like that we're not interested in resuming this care. We're very much interested in safely resuming and restarting the care that does need to happen. And I agree with what Scott's saying. What we're seeing more of is a need to be able to restart the everyday services. So when you look at the restart plan that we announced last week, it's heavily focused on primary health care, community-based care, and also those patients who need their care reassessed and to be escalated or reprioritized in terms of its urgency.
Do you have a follow-up, Lisa?
Yes, this question is for Dr. Shahab. Looking at the numbers here of the active cases in the province, there are no active cases in Regina or the southern area, and I think that's the first time that that's happened since the pandemic started, since we started getting cases. What does that mean for those areas and for the province?
Hi, yes, thanks. So we were, we have been tracking this for the last little while, and as you have noted, new cases have become very rare in the rest of the province, and I think that is a very positive note for two reasons. One, it puts us in a good place to cautiously reopen, but we do also realize that there is an outbreak in the northwest of the province, and we have seen from many other jurisdictions that even when you start reopening, you have to be diligent about maintaining your physical distance. And that will be essential as we move forward into the new normal. While things are very quiet in the south of Saskatchewan, we have to make sure that, as Dr. Krasnowski said, anyone with any even mild symptoms anywhere in the province, step forward for testing. That is important for their health of their household members, but also to keep us informed of COVID activity anywhere in the province. And even if things are very quiet, when we re-engage, in business activity or going out for allowed recreation, we continue to practice all the things we have been practicing, including maintaining physical distance. Thank you.
Is there another question on the line, please?
We have Mark Smith with CTV.
Hi. How has the effective reproductive number changed in the north and the rest of the province over the past week or so? Is it on a decreasing trend? Is it steady? Is it increasing? How is it changing?
So Scott, you could speak to it. I spoke to it yesterday, but it's in your news release. I could speak to it.
Sure. Do you want to start, Shahab, and I'll add?
Okay. So as I said yesterday, the modeling for the north is ongoing, but we have, of course, we were expecting our provincial reproductive number to be low, and it was around that 0.73 mark, but it was pulled upwards primarily due to outbreaks in Lloydminster and the Loche. Now, we have seen the outbreak in Lloydminster has settled down. There continues to be some ongoing cases in the Loche, but they're also settling down. But the provincial RT, effective reproductive number, did get pulled up to around the 1 mark. But when it was disaggregated to look at the Loche separately and the province separately, the provincial still remains well below 1.74, and I understand there'll be further modeling on that. And while the number for the Loche remains high, we can understand that because of the ongoing outbreak. But obviously, we would like to monitor both the epidemiology and the modeling, both at a provincial level, but also at a sub-provincial level, especially when there are outbreaks or clusters. Thank you.
So the only thing I would add is, in Dr. Shahab's comments around the north and south is we have one number that's certainly below 1 where we want it to be, which talks about and justifies many of the things we've already talked about today, like why isn't there more testing in the south when we're not seeing cases? But it also, at the same time, where we see that number above 1, supports the aggressive measures we're taking in place in the northwest to ensure that that community is getting all the supports that they need to help tide their reproductive number back down to more closer to a provincial number and certainly under 1, and that's going to take us some time. But that's really what the numbers tell us. The other thing is as we've talked about before with the dynamic modeling, is the more data we get from Saskatchewan, the better our model gets. And, we will continue to update the model and provide updates on what's going on. And that's something that the team is doing, on a weekly basis. So.
Is there a follow-up, Mark?
Yes. The website says there was 256 tests performed yesterday. How many of those were in the north and how many of those were in other areas of the province?
Derek, do you know that number? I don't have it off the top of my head, but we would.
Sir, I don't have that right at my fingertips. I don't want to give the incorrect information. We could follow up with that.
Okay, we'll get you the number, Mark. It's a significant component of the total tests.
You bet, Mark. We'll follow up with you after the call here. We have time for one final question. Is there anyone on the line that would like to ask a question? Great, thank you very much.